Engage, like John.
And we're live. It is 4:00 on Wednesday, March 15th, and we're going to have a bit of a committee discussion on our suicide prevention testimony for a little bit, and then we'll let everyone go have a good evening. So I'll just kind of set the stage. So, during the last suicide prevention bill that we did, there were a lot of ideas and things that we all talked about we wanted to continue to look at. And so we set up this week of suicide prevention testimony. I will say for me personally, I think it was really eye-opening with how much is being done in the state. But again, and I've said this repeatedly, how much of it is, kind of all over the place. And there's really no strategic state vision for suicide prevention. And then to hear from the schools today, which again, it's all done, at a local level, and schools may or may not be doing anything. So, and then I think the other thing we have to really keep in mind is we do have this new director of suicide prevention, right? So just started in January, getting his feet wet, and is looking to build a strategic vision. But also in conversations I had in the hallway with them, would be interested in having legislative input as to the policy direction of that strategic vision. So that is something we could include in a bill. And then we learned a lot about the Suicide Data Linkage Project, which we didn't know about, and then talked a little bit about the Suicide Fatality Review Team. So I'm just going to open it up to what people are thinking at this stage of the game about what we might need to do. So I'm going to go Brian and then Daisy.
Yeah, there's two things I would like in there, and if we can't do it, it's fine. There's just two clear things for me, which you are not going to be a surprise because the questions I asked. Like, one would be to just jump on what you said, work with the new director to come up with language for a study that not something expensive, using existing, trying to do it in a way that's using existing resources wise in a way that, and maybe it's some legislators and stakeholders, it doesn't have to be a big study group, but basically a group to work with the new director to do like an assessment across all systems of government. So it's like checking in with the schools, checking in with healthcare, checking in with criminal justice, et cetera, and coming back kind of with a plan and recommendation, something like that.
Okay.
Something like that. But I think that a little bit of money spent on that at this point would be a good investment, because then we can make better decisions. And the second thing would be, I feel really strongly about the partnership with gun retailers. I clicked on the link I think Nick Nichols sent us about gun shop partnerships around the country in different states. There's like a lot of states, and it started in New Hampshire, it looks like, and it seems like it's really successful that they work with retailers to give materials that are culturally appropriate for the people coming in, like the people they know who are their customers, and that idea of like education for retailers, so that if they see something, they could just show that. We were talking about how people already, off the record, we were talking about how people, but I want to give you credit that you were saying people already are educated on many things and take that job seriously. So I think just giving them more tools and it being partnership. Like, I don't mean like the state coming in and like assuming someone doesn't care, doesn't know something. I mean like engaging with them and saying like, what do you need to feel like you are more comfortable intervening if you think someone is not well. And so I don't know what that looks like, but I feel like there's something there. It would be a missed opportunity if we didn't do it this year.
Okay.
Or maybe that's in the study. I don't know. So.
Okay. Daisy and then Alan.
I loved the testimony that we received this morning, and the kind of diversity of experts that we heard from, both educators and Dr. Bell and her medical expertise, and Terry Lavallee, who I know from the time that I worked at DMH, and her expertise in suicide prevention at sort of the implementation level, I think is something that should carry a lot of weight when we hear what recommendations she has. And what I took away from that is that suicide prevention and postvention is everybody's business. And I also heard, both now and on testimony on 230, the bill that we passed out of here, that our state partners are already underwater. And I saw that in our budget that we passed, where we included 3-point-something million in vacancy savings. So I would recommend, rather than trying to stand up another DMH fatality review board or suicide review board, that we look to the existing supports that exist as public-private partnerships. I reached out to United Way, which runs a mental health initiative, and they have a suicide prevention action team that's made up of like 25 different partners throughout Northwest Vermont. They shared some recommendations with us that I'll pass around, that are broad. They include things that really align well with what we heard here, including supporting public health campaigns to address misinformation with the 988 service, especially among historically marginalized populations. I think that kind of echoes ones that we brought up in brainstorming here, talking about health equity. Another one that I think is really compelling, I'd like to get behind, is support for Vermont's School Safety Center to develop and implement school-based public health campaigns that address injury prevention. Some of those are things that grants, like SAMHSA grants, can't get through, like marketing, they can't fund. So anyway, I can send those around, but I think when we look at having a plan for something that is strategic, there is one that exists. It exists, it was built at CHL with the Suicide Prevention Coalition. It was last updated in 2015, and I think it was made by a nice cohort of diverse stakeholders. And I think we should maybe look at infusing that and use Chris's leadership, the new director of suicide prevention, but I think I might question whether the entire effort needs to rest within DMH versus perhaps a public-private partnership. Because I think just with what we see with positions and leadership, I think it's a huge effort. I think it's everyone's business. And I think that the Suicide Prevention Coalition that we've had in this state has done excellent work. And I know we've seen a lot of people in here testify who are members of that. And I think we'd be doing well to build upon what they've already done.
Okay.
I think I agree with you 100%, but we could be doing a disservice by pushing something this soon, because we do have a young man. I was impressed with the young man, and I would work along with him and do it right. And then, you've heard me say we're duplicate this. I don't want to do that. So I agree with you, Nancy.
Okay. Listen.
So I think we've heard a lot of testimony. There's a lot of irons in the fire. I think that probably at this point, what we should do, we did create the director. Let's see what can happen. I do think that we should put out legislative intent on what we would like to see happen as regarding a statewide strategic plan. I think every single thing we heard has basically proven that it's just been this ad hoc and nobody's really going anywhere together, and there's not, a holistic approach. So maybe we task the position that we created with the vision of somebody, this needs to be housed in one place. And we set a task that he work in collaboration with DMH, obviously VDH, the stakeholder partners, the Department of Education. I don't know about the rest of you. But frankly, I was a little sad after our testimony this morning in that there just isn't, I mean, these are our children.
Yeah.
And there just isn't a cohesive plan on how we're dealing with. I mean, when we asked about post-vention services, there was nothing. I mean, do you know what happens to a school when a child commits suicide? I mean, to the teachers, to their friends. I mean, we need a plan. So how about we task them with coming up with a strategic plan? And come back to us.
Okay.
Oh, can I say one more thing?
Yeah.
About the gun shops project? Because it is a great project. It is touted on the Department of Mental Health, Vermont Department of Mental Health website as a partnership. On the map of all the states, Vermont is on there, but let us remember that we had Chris Badley in here who said, yeah, we don't do it anymore. So I don't know, maybe we ought to think about
Doing that again.
doing that again.
Okay. Leslie?
Well, I think that could get inwoven, I'm not sure that's appropriate into the strategic plan, perhaps. I like the idea of the strategic plan. I was sort of struck also, as you were, by the chaos at the LEAs, but I'm probably less a fan of local control than others. And this is a really good example of where local control doesn't work. I was interested that the LEAs are required to have a policy on bullying, hazing, and harassment, but not suicide. And might be interested in including that somehow direct the school districts to have that, which then could include postvention as part of the policy. I think that I was struck by, and I can't remember who said it, I think it was you, Brian, that it was all governmental agencies that were involved in their data collection, and I'd like to see it beyond government somehow, and that be included in our strategic plan, because I'm still thinking about the social autopsy and what that means, because I'm not clear. And I don't think that they're really clear on how one goes about. I sort of looked it up and, was learning about it as we were listening. So I think that's important because of just what you just said, the ripples, right? And, sort of the ripples start out there and come into the person and then they go back out again. So, we need to think about that. I'm sort of still inclined to think about the suicide fatality team, because how else do we learn? I think that's where the social autopsy happens. So I sort of would want to include that. I understand that there's a huge difference between 6 cases a year as opposed to 142, and that somehow the medical examiner might have to refer appropriate ones to them. And we can make a decision about that somehow, or eliminate. And that may be part of the strategic plan. We just say we want it explored and not give any direction. But I still like to include that somehow.
Okay. All right.
Yeah, first of all, there's just so much stuff here again. I mean, I guess I hope, against hope, there would be some organization to it, but there isn't. I thought the Agency of Ed people were, and I understand it, that they're trying to be education people, but it seemed there was a disconnect with some of this. I felt, they didn't say it, but I felt like it. I would be in favor of allowing Chris, and I can't think of his name, and I don't know what his position is, the suicide prevention position.
Chris Allen.
To let him have his head a little bit with structure that we might be able to provide him. I think data needs to be one of the key things about this, and I think everybody here probably thinks the same. But when I was a kid, young person, I remember my parents saying that, gee, there's a lot of suicides in Vermont. This is nothing new in terms of, I don't know empirical numbers,
Okay.
but I'm not sure the rate is any different today than it's been for a long time. But I think we need to look at that data just to give us a sense of direction. Doesn't mean we don't do anything, but it does mean, you know, it puts us in a framework of time and a set path that might guide us. But I think Chris needs to be given time with some guidelines. I like Brian's idea of a group that maybe works with him and kind of, you know, let's mold it to what we want, revisit it in a year, maybe, see where it's at and see what we need to do, maybe. That might not be a good plan either. I don't know. It's complicated.
Only if you want to. But I know someone wants to speak again, so.
Yeah, I don't know what this means, but I just kept thinking of some kind of like a toolkit that we could produce and mass produce that would be distributed to almost like every family, like a suicide prevention kit, bringing out into the light the idea that suicide risk is not something. I mean, you know, we've been through this as a society where mental health was sort of something that was whispered about and talked about quietly, and now we realize the benefit of bringing it out into the light. And people like Terry sharing her experience like that.
Yeah.
Was a shocking revelation, but it also made me admire her so much more because I realized how much more her experience is useful in that. So I was like, how do you turn that into something that could literally be delivered in a box to everybody's house? You know,
Right.
that's something that maybe Chris Allen could work on or something like something.
Right.
I don't know. Maybe it's just too cute to have like a
Those
package.
are out there though.
What's that?
Those are out there.
I know, but I'm trying to think of a way to get it to everybody's hands.
Right.
You know,
So
and-
your overarching idea is that we need to get something we need tools out there that every family has access to.
Yeah, and not just like a flyer,
Right.
here's a number, because of course 988 is important, but more like some concrete helpful tips and tools that, you know, something like that. I don't know, that's just what I was thinking of. As an educator, that's probably, you know,
Yeah.
do it that way, like a packet, you know, or something, or a box.
Right. Okay. Okay, I'm going back around. So I'm going in the same order. Brian?
Yeah, so after hearing people, like, a question I have is, would we, what's Chris's last name, Allen? That I would want to know what Chris Allen thinks, because it's his job. Like, does he want to work with a study group to just do this like quick assessment, or does he want more of an advisory council for a few years to be there, you know, advising and be more supportive? And then I'm wondering, is there a way to combine that body with the fatality review? And it may be too much work for them, but like, I'm thinking like, if the expectation wasn't to review 120 deaths, it was to review the data and maybe pick a case or two to go in deeper. It might be something they could do with him while they're planning policy, but that also might be too much. But I just wanted to put it out there that there's something valuable to the fatality review team, but I don't know if it's realistic for anybody to, any like governmental body to investigate 120 deaths adequately. But if they reviewed the data of those deaths and then picked like 2 or 3 cases to go in, that actually might be doable. And then if that work could be combined with the other work that's needed to assess the system, it could just be that there's one, because as much as I don't want to limit public engagement, I also am mindful of the amount of boards and commissions and councils and that we create, and then we don't do what they say a lot of the times too. So I don't want to just keep perpetuating that. Yeah. So if we're going to do this, we need to really listen.
And I think that's an important point that I have realized sitting here and listening to all of this. I've been here for 6 years. I didn't know we had a child review fatality team, and I've never seen a report. But so that's on us, right? Like, we're not paying attention to the recommendations that are already being done by boards that are already out
We
there.
don't know. I'll argue with them.
So one of the reasons that we are blessed to have Chris Allen is because the work that he now holds used to be held by the deputy commissioner and myself.
Right.
And so my understanding is that position was created by you all to be sort of a managerial,
Right.
sort of holding all of these
Yes.
pieces, right? So the work of CHL, the work of UN contracts, the contracts
Yes.
that VDH and everybody has. And so I just wonder if it's worth revisiting in statute, like how much leverage do we have over the direction that that position has versus the agency deciding what
Well,
they hold.
so our leverage is we have a policy direction. And so that would be what we could put forth from this committee this week is as part of your strategic planning visioning, we want to see these things. And how we would, what's the plan and how do we implement? But they could come back and say, well, we don't think those are important. So. Or they could come back and say, we think these other things are important. But it would give some policy direction.
We might tie it to the existing, they refer to it as the platform, the suicide
Right.
prevention platform, and that's in a different one, that's in the CHL grant. But I think if we want a strategic plan, like the policy asking them to update the suicide prevention
Right.
platform that hasn't been updated since 2015 is.
Right. But also, are there things, for instance, I've been taking notes as we've been doing all of this conversation here and the last couple of days. So somewhere, someone talked about, I have to go back through all my notes, like how do we work or do we work? Is there some part of the strategic plan that has to tie, not by call volume, but 988 to 911? So like, how is there a connection there? Is there not? Let's look at that. What are the post-vention things that we should be doing statewide? What are things that working in collaboration with AOE that we want the Agency of Education to come back with as part of a strategic plan? So it's more like, broad-based things that we collectively think, okay, well, we've heard these things and we want to understand how that would all come together through a platform and a statewide plan.
And we asked them that in the budget, and their response was that they are hiring we asked them, what's your plan for crisis response
Right.
system of care? Because we're making all these investments, and they said that they have under contract or out to bid, a contract for an external consultant to come in and design that.
For that
strategic
program,
plan.
right. But we have the person, right? So to your point, we hired the director of suicide prevention already. And it is our intent when we hired that person that they would be the coordinator for all statewide activities. And so I think what I'm hearing, at least from a majority, is, okay, let's continue with our legislative intent and direct from a policy perspective what we want Director of Suicide Prevention to be looking at as part of a strategic plan and come back to us in January with a presentation on what that is, right?
The mobile crisis wouldn't be part of that.
It could be, it may not be, but that's up for, and we could say, we want to understand how mobile crisis factors into your suicide prevention strategic plan, right? But this is directing the Director of Suicide Prevention is what I don't see it, yeah. So anyway, I don't forget who was, go ahead, Alan.
I think everybody that spoke had good points.
Yeah, absolutely.
But how do we take all the good points and bring them into one? And to me, I got a little pet peeve. Terry Lively, when she talks about getting everybody involved at a younger level, I think, that's part of the plan. If we work with Chris,
Yeah.
I think we can implement a really good system. But,
Okay.
I don't want to hurry. I want to be proactive, not reactive. And I
Right.
think a lot of stuff is reactive stuff.
Yes.
So,
I absolutely agree with you. And I think putting our intent forward is being more proactive. And, there is this coalition, right? Suicide Prevention Coalition that Chris is already working with. But then maybe we need to put in legislative intent that also seek out input from marginalized communities, youth. So things for us to talk about tomorrow afternoon, but
Follow-up
that's,
question. Should we get him back in here?
Chris. So he knows we're gonna talk tomorrow afternoon, so I was gonna touch base with him later on, whether or not he's here, but, it's his choice. Alyssa, did you have something else?
Oh, I wanted to just, because I left out the fatality review team. So the current thing that they're doing now is they're looking back at 20 and 21. I mean, personally, I'm still not clear on what data they're collecting or the intent of it. I mean, just from somebody who has spent years kind of embroiled in statistics and read every single thing that is on EH's website. I mean, I know where they get all their data from. They get it from death records, death certificates, because there's a lot of information on a death certificate. You know, I mean, when they're talking about things like they're going into construction companies and because they know that they're at high risk, it's because your occupation is actually on your death certificate. I'm just wondering what gaps in demographic information or social autopsy are we missing if we don't continue to collect that? So perhaps, I mean, I understand the work involved in 142 people a year, but I also want to mention we have fatality review boards for children, domestic violence, and Nick said today that this was built on opioids or overdose
Well, the
deaths.
study
The study was, because we had a fatality review board for overdose deaths. There's something we can do, recommending just maybe a little bit more data collection. I mean, this data is collected. It's just not collated anywhere.
And I think we heard that loud and clear from several witnesses. So yes, is there some way we can put something in there around the data? I'm gonna be real honest as the chair of the committee to say, I don't feel comfortable with us putting forward a suicide fatality review commission or team, whatever, right now, because I don't think we've taken the proper testimony. We haven't heard from the medical examiner. We don't have a commitment from BPH. If we had started this sooner, maybe we could be putting that forth. But I feel like we haven't done our due diligence on that. I think it's needed eventually, but I think at this moment in time, we haven't done our due diligence and we won't be able to by Friday. So I'm just putting that out there.
Yeah.
But at the same time, I think we can get the report from the Data Linkage Project in September. And I think that's going to be a really good indication of what we're missing. And set up the testimony for January to talk about, bring in the people medical examiner who's really working on the child fatality review team and look at the data linkage and what's missing. So do we need a suicide? It would help us determine if we need another team. But I do think there's something we should put forth, like our intent is that data needs to drive our policies. And how do we make sure it's all together?
We could also put in there, along with, we're tasking a strategic plan, that one of the things that possibly they could be looking at is the data that's being collected in the current, I can never remember the name of it, whatever Nick is working on.
The data linkage.
Data linkage.
Yeah.
What data is in there that is proving valuable that we might want to collect in the future?
Yep.
Or what data are we missing?
Yep. Leslie?
So Terry Glavely said something about moving upstream. So I guess I'm thinking about it from 2 points of view. I'm thinking about it from a prevention point of view, which would include, schools and LEAs and, we were talking about giving information to every person in the world. if possible. And then
Or just Vermont.
in our world,
Our world.
in our world. And then the post, event experience and tragedy. And that that we ask Chris to create a strategic plan looking at both aspects. And the suicide fatality, when from a medical point of view, when something bad happens, you do a root cause analysis. And I see this as the same thing. It's a root cause analysis of why you need this particular individual, and it may be this one or that one or whatever. And I hear what you're saying about we don't have enough robust thing to set it up. And I wouldn't want to set it up, right? Because he's got a boss and he's got a whole DMH sort of infrastructure. So no, I don't want to set up a suicide fatality team, but I want to ask him to explore it. And what that would mean. So I think from the strategic plan point of view, what I want to hear from him is, what is he going to explore for prevention, and what is he going to learn post,
Right.
whatever the rest of it is, I'm sorry. And then leave him and his department and his bosses to figure it out, and then report back to us about their recommendations so that we can start engaging.
Right. Okay.
I think that, and I don't know what you were doing this morning when I came in, you were being interviewed.
I was being interviewed, yes, on the other bill.
Okay, well, be interviewed on this. Be interviewed.
He asked what else we are doing, and I did talk about all the testimony we're taking this week. Yes.
I think a media blitz that this group, and that you've got a director of suicide prevention, which I'm sure no one in this
Right.
knows other
Yeah.
people in this room.
Right.
If we got that word out there and say, hey, look, we're very interested in reducing the suicide rate. We unfortunately lead the nation. I don't know
Right.
for sure, but spell out some of the stuff. Say, look, Vermont, suicide's everybody's business. Suicide. We ought to come up with Chris ought to come up with a logo, a motto.
Right.
And that's the one we want to have and get it out to the public and let them know, hey, this is something we can all develop together. and maybe approach it that way. That's just one little.
Well, and that's a really good point, Art. And I will say, so I think a couple of people mentioned that they're appreciative that we're taking all the time we have been taking on suicide prevention, because we haven't, in the last couple of years, since I've been here, really, we did some stuff, but not a lot. And it's partly our job to get the word out, right?
Right.
So, and passing a legislative intent policy direction, I think, is a good step in that direction. And then also getting it out into the media. So, yes.
But can I comment on that if I may?
Yeah, and then you'll have the last word.
Oh, gosh, the last word. I hear what you're saying exactly, except a media blitz is like done, gone, everyone's forgotten about it. So I'm hoping
Has
that
to be continued.
it has to be like this ongoing, really thoughtful, not that what you're saying is, you know what I'm saying? I'm just,
Yeah.
Yeah,
it's
sure.
gotta be
Leslie.
long-term and embedded and, that's what I'm hoping.
Yeah. No, agreed. Thank you. This was great conversation. So I'll get with Katie McGlynn and we will have some sort of draft language ready tomorrow afternoon for us to look at. With something we'll have to finalize tomorrow in order to have it posted to then vote on Friday. Well, we don't have to have it
You have a lot
finalized,
of,
but
on the other part of this, you have a lot of bills that include now, they're gonna go through the system tonight.
yes, there's a lot.
So it might be late. when you
Yes,
get it.
there's a lot happening tomorrow. So, but I don't think we'll be too late. So we'll work on that with the intent to put something out by Friday afternoon. And then just a reminder, the other thing we'll do tomorrow afternoon is take about half an hour and walk through the commerce workforce suggestions. So we had pushed some stuff off to commerce, like the EMS workforce and some Vermont Care Partners and nursing scholarship. They just want us to take a straw vote. So we'll just do that as a committee sometime tomorrow afternoon as well. So unless it's policy, we'll go off air and then you can ask, is it?
No, it's process about bill presentation.
Okay, so we can do that off air. So we will see everyone tomorrow morning at 9 a.m.